Hello, everyone. Welcome to the Medical Report, where we bring health to your ears. We are your hosts, Olu, and I am Anita. And we have a special guest with us today, Dr. Qualls, with Quality Health, Physical Therapy, and Wellness. Thank you for joining us.
Thank you for having me. I'm glad to be here.
Yeah, so today we're excited to talk to you all about strengthening your pelvic muscles and improving your sexual wellness. And before we get started, Olu, how you been this week?
I've been okay. Week went by pretty fast, I would say. How
Okay.
about you?
Nothing fun?
Nothing fun. I don't do anything. I don't go anywhere.
Okay.
I sit in front of my computer and I wait for this
Okay.
every
You just sit there. Cool. I am in Florida now.
Okay.
So I started doing some clinicals for my last rotation for psychiatric nurse practitioner certification. So I'm in Florida for the next few weeks. So it's been a little crazy, but I'm excited to be finished. Otherwise, today we're talking about the pelvic floor and strengthening those muscles. We can get the slideshow up here, background man. There we go. Pelvic floor is a collection of muscles that make up the lower aspect of the pelvis. Present in both male and female, these muscles do not only provide structural support, but they're responsible for bowel, bladder, and sexual function. As we get older or as our bodies endure different changes, such as pregnancy, we can experience a gradual weakening of these muscles that cause various symptoms. I've commonly seen this in my patients that have experienced issues with pelvic organ prolapse, which is basically when there's abnormal herniation or descent of those pelvic organs from their normal anatomy, like normal placement or position in their pelvis. And also, I've seen it with patients that have incontinence or a loss of ability to control their bladder or bowel. Any of this pelvic and organ prolapse can involve the uterus, it can involve the vagina for women, or the bladder in men and women. I've not really seen it in men though, mainly women. When this occurs, there might be a slight abnormality noted. If it's minimal amount of displacement, then surgical intervention is usually not necessary unless the patient is experiencing some severe symptoms or is having no improvement after trying non-invasive options. Great first step for non-invasive options are things like pelvic floor therapy, which brings us to our guest today. Yes. So, in your experience, what conditions have you typically been treating with pelvic floor issues? You can put the slideshow off, please. Thank you.
Well, first thing, I wanted to just do a minor correction. My company is Quality Touch Physical Therapy and Wellness, by the way. So, to answer your question, basically, there's so many different conditions. First of all, I would just go over some general ones first, and then we can get into some more specifics. But basically, what I see a lot of are conditions dealing with urinary leakage, urinary retention, constipation, diarrhea, abdominal pain, sexual dysfunction, of course. So, if they've ruled out any medical cause, erectile dysfunction, I can treat patients who are experiencing erectile dysfunction. Um, Post-surgical, so after hysterectomy, after any kind of flap surgery, after a male has had a prostate removal, different things like that. Pregnancy, postpartum, the list goes on and on.
Yeah, that's quite a few, not more than a few, conditions that are definitely addressed. There's a lot of things that the pelvic floor really supports anatomy-wise. And so, yeah.
So, that you see, and also,